In this video, I'm going to take you through 5 factors that may mean you need a hip replacement. So watch until the very end, because it's not something that you want to go into lightly. It's an invasive surgery that requires a fair amount of hard work and recovery afterwards. Tip number 1 is that you have genuinely exhausted conservative treatment. Now, this normally means some support from a physiotherapist or a physical therapist, education, advice, exercise, which normally involves a combination of cardiovascular exercise, but also specifically strength exercise for the muscles around your hip, and also weight loss if appropriate. And within the education advice component, there's lots of different things that you may find helpful. Anything from talking about how to manage flare-ups, to different pain relief options, to different topical gels and creams, and maybe even supplements. So the first tip is to make sure that you've really given the conservative side of things a good go first before you jump into having a hip replacement. Point number 2 is pain. Now, we're talking quite considerable pain that's getting in the way of daily life and is not responding to point number 1. And it's really important that when we are talking about osteoarthritis, we appreciate that there is a massive spectrum of severity, and it varies significantly from person to person. So you could be at the good end of the osteoarthritis spectrum and be able to play a couple of hours of tennis and have a slightly stiff knee the next day, or you could be at the more severe end of the spectrum with your symptoms and pain and be getting quite consistent night symptoms, be struggling to weight bear, and it be having quite an impact on all of your life. So where you fit on that spectrum of pain severity and for how long you've had it will dictate whether a joint replacement is appropriate or not. This leads us on to point number 3, which is other factors that this pain is affecting. So if your pain is starting to consistently get in the way of your sleep, and it has done for a prolonged period of time, that is not good. If your pain is starting to affect your mental health, obviously that's not good. It might be that the fact that the pain is getting in the way of your work and your ability to earn a living. All of these factors should be taken into account when you're considering a joint replacement. And the more invasive your pain is and the more other factors are affected, the more you may want to think that a joint replacement could be a good option for you. The 4th thing that may mean you need to consider a hip replacement is significantly reduced range of movement. Now, I need to clarify what I mean by this. So we're talking about a proper stiff hip. So when you have osteoarthritis, the joint space becomes narrower, and that subsequently means you have less movement available at the joint. Now, as a symptom, a lot of people will experience pain-limited range of movement, where you take your hip to a point through range and it's sore, so you stop. But actually, if that pain wasn't there, you still have a fair amount of movement left. So we're not talking about that. We're talking about people who are really struggling because they just feel like there is a bony block in their joint. Often it's painful, but some people find they just get to a point and it just does not go. I think if you're confused about this, it's really important to get a physical assessment from a musculoskeletal specialist where they can move your hip around. They normally bring your knee up to your chest and that's reduced, and there's some rotational movements that they can take you through as well to really assess how stiff your hip is. You may notice yourself during the day that you're struggling to put shoes and socks on one side, but you're not on the other. Sometimes that's because there is no longer that range of movement available in the joint. And if that is the case, it's unlikely that physiotherapy is going to get that movement back, and therefore that's a factor that could increase your chance of needing a hip replacement. And point number 5 is an x-ray that shows a significant amount of osteoarthritis. Now, I say this one with a degree of caution because x-rays do not always correlate with pain. So you can have somebody that has a fairly ropey looking x-ray with not much pain, and vice versa. So you can have high levels of pain with not much radiographic change. So what we're talking about is all of the things we've discussed so far. So significant symptoms in conjunction with an x-ray that shows at least moderate to advanced osteoarthritis. It's highly unlikely that a good surgeon is going to operate on a joint that has early or minimal amounts of osteoarthritic change. I really hope you found that helpful and that gave you some idea as to when a hip replacement might be a good idea and when it might not be a good idea. I think in summary, it's very, very rare that you should be referred to orthopedics for a surgical opinion straight away without trying anything else first. There are no guidelines that suggest that is a good idea or a sensible approach. So be sure you have tried everything that you can first to make sure that it is actually last resort. If you would like more help with conservatively managing your hip osteoarthritis, then there's a couple of guidebooks in the description below, one on hip pain and one on osteoarthritis, that you might find helpful. And take a look at the YouTube channel, Genuine Physio. There's workouts on there specifically for hip osteoarthritis that you should find useful as well. And if you would like less general and more bespoke, tailored help, then I do offer a very limited amount of private appointments on a weekly basis. You can find information about those as well below the video. Please do like and subscribe whilst you're down there. It means that more people will see the video that you found helpful. And whilst you're doing that, I'll see you in the next one.